Hi, welcome to Professor Kev Show. I have Sarah and Aishu from Mind4Youth with us. Good afternoon. Welcome to the show.
Good
Good.
afternoon. Thank you for having us.
Of
How are you
course,
doing?
just living the dream, my friend. So why don't we jump in? Why'd you start this nonprofit?
Right. So Sarah and I had different ideas for why we started the nonprofit, but we all had a shared objective. For me, it kind of came from the immigrant struggle and kind of having family that maybe doesn't understand mental health or has stigma around mental health. And this kind of created a lack of resources and opportunities and a lack of education as well for me. So as I grew up and I learned more, I realized that this is happening for people everywhere all the time, as well as I grew up in a very competitive neighborhood in the Silicon Valley, which Sarah's still in. So good luck to her. But that kind of created a lot of pressure and expectations. So mental health has always been something I've been really passionate about because it's been a part of my life, forever.
So now how are you addressing this? How are you helping people with it?
Yeah, so I think one of our main ways to do this was starting an organization which has become Mind for Youth. And so with Mind for Youth, our main goal is to provide underserved youth, particularly ones from either like low income backgrounds or youth who are in poverty, so at homeless shelters with mental health resources. So we're making it more accessible for them because we found that barriers like financial barriers are a really big problem that prevent many youth from getting the help that they need. And so we want to make sure that mental health is something that youth are able to prioritize and it's not also having such a large stigma around it. And so we've done that through a lot of different programs. One of them, for example, is heart care. So we've created these kind of heart care kits with our which are boxes with items like a free therapy voucher from our partnership with BetterHelp to provide teens with free therapy. And then we also have like other small items like mental health merchandise just to promote mental health awareness and kind of get rid of that negative notion that kids might have around mental health that, oh, it's something that I'm not so comfortable talking about. And so we want to make mental health something more positive. And we also have things like bath bombs and self-care items, which are provided by our sponsors who are Lush. And so we've been very fortunate to build a lot of community partnerships to increase our work's impact.
I love the direction you're going in because, again, as a professor, I see the stigma associated with it. I mean, I can clearly see it in class that something's changed. And if I approach you, I don't want to talk about it. Well, we need to talk about it. That's how we can help you in it. So anything involving that and making it better, I do appreciate. So what's the future hold for you? What are you hoping to accomplish?
We hope to accomplish just expanding our organization to reach as many underserved youth as possible into many different countries. Right now, we're based in Canada and America, and we have done heart care events there, but we hope to expand into Zambia and other countries around the world. I also want to create more educational resources for the public itself that are free and available, and they're not subscription models, and you don't have to pay for them. They're just free and they're there for you to use. Hopefully, we can develop them in the future with maybe a team of programmers and designers and work on kind of creating modules. I would be really interested even to make a mental health game for kids because I believe it's important to start education early. So you don't want to create the stigma of, oh, there's no issues. And suddenly you're in grade 12 or you're in university and you're losing your mind because of these grades and you don't know how to deal with that. So we need to start education early. So those are some of my plans or our plans. But Sarah, do you have anything else?
I would say the only thing is self-care program that we're starting that's new. And so with that program, we're trying to give underserved kids again things like gifts and other self-care items to promote mental health awareness. But unlike our heart care program, this one is more directed to youth who are in extreme poverty, so directly at a homeless shelter. Because our main goal with kind of giving gifts, especially during the holiday season, is just to make sure that every kid feels like they're being included. And I think that kind of having that feeling of being an outcast during the holidays can be something that's really detrimental to mental health.
Yeah, and we want to shift away this perspective of mental health support or self-care as a luxury and into making it more of a priority and a right for all the kids around the world.
So what's the best way for people to reach out? How can they learn more?
Yeah, definitely on our social media would be a great way. We have our Instagram username is at Mind4Youth Official. And then also through our email, mindforyouth.contact@gmail.com is a great way to get in touch with us.
Awesome. I appreciate
Check
both.
out our website as well.
Okay. I appreciate you both taking a few minutes to call into the show. And as always, thanks for being my friend.
Thank you so much.